In an academic center, we're often referred younger patients, of course, so not perhaps your typical older patient, but somebody who's quite young for their disease. I've actually seen patients as young as in their 20s, believe it or not. But a more typical patient might be somebody in their late 50s who's diagnosed and often doesn't need treatment initially, but eventually will come to treatment, and they're still young. Of course, people can have significant comorbidities. In the trials, that's measured by what we call the Cumulative Illness Rating Score, the CIRS score, which I'm not a big believer in. It's pretty easy to determine whether somebody's truly fit for a chemoimmunotherapy regimen or not. Do they have poorly controlled hypertension? Are they overweight? Do they have diabetes? A lot of the, you add up those risk factors and it's pretty easy to decide whether you're thrilled about giving somebody a more intensive regimen, one which might cause neutropenia, lead to infections, for example. So there isn't anything really objective that I add up to make that decision. The other factor that can play a role here too is renal function. So a lot of our standard drugs are renally cleared, and so those with chronic kidney disease, one has to be particularly careful about giving some of our chemotherapy drugs to because they'd be more prone to myelosuppression and therefore more prone to infections. So for a younger, unfit patient, a drug like Ibrutinib would be a very good option as well from focusing on the tolerability, the safety aspect. So you're confident that you're going to be able to deliver the therapy in that patient without having to interrupt because of complications, and therefore you're confident you're going to get the full therapeutic benefit. So of course in the trials, including the RESONATE-2 trial, we weren't treating patients under 65, but since it's commercially available and in other trials that are ongoing, we have done that. So for example, a large national trial, patients under the age of 70, FCR versus Ibrutinib plus rituximab. That trial has accrued over 500 patients. It's fully accrued. We've treated patients on that trial, so we'll wait and see what that shows.